The next question is somebody who had stage 2 colon cancer removed earlier this year, and this person was not offered chemotherapy, and then I've recently learned about Oncotype DX and other tests. Can they still be run on the cancer that was removed? The hospital still has the samples. So yes, the hospitals keep your tumor tissue that's removed for many years. Usually they keep it handy for a year or two and then it's shipped off to a warehouse, but even 10 years later you can still retrieve the tissue. However, that tissue is what we call formalin fixed, so they put it in some formaldehyde to stabilize the tissue and to cut it. We can actually still analyze the DNA from tumors thanks to a lot of work that people have done over the last few years, figuring out how to extract DNA from formalin, because the formalin can cause some DNA damage. But it is still possible, and this can be done, and it is done fairly routinely. I think for somebody who's now more than 6 months after, though, I'm not sure that the Oncotype test would really be helpful, because usually we use it to choose chemotherapy right away. And if it's a long time after, like more than 6 months after surgery, we don't know that that kind of preventative chemotherapy, what we call adjuvant chemotherapy, would still be helpful. So the answer is you could get the test done, but whether it would be helpful in deciding on treatment, or whether treatment, even with a high recurrence score, you know, and a test that suggested that you were at high risk for recurrence, if you did the Oncotype, you know, whether it would be beneficial to give you treatment this long after surgery would be the question, and I think nobody really knows the answer to that. Usually, personally, if it is that long after a surgery, I wouldn't recommend any additional treatment.